So today, Dr. Esma and I are diving into the question everyone whispers about. Can someone really walk into a clinic with missing teeth and walk out the same day with a full smile? And trust me, Esma, people online are arguing about this like it's a conspiracy theory.
Rasim, the funny part is, some of those conspiracy theories aren't entirely wrong. They're rare things most patients never hear, and yes, one-day implants are real, but not in the way many imagine. Let's just say there's a twist coming.
See, this is why I brought Dr. Esma. She smiles like everything is fine and then casually drops a cliffhanger. Stick with us, because the part nobody explains is exactly where people lose time, money, and, sometimes, bone. Dr. Esma, every week someone messages me saying, Rasim, I just want to chew properly again, smile without hiding, and not wait months. But then they go online and get completely lost. Too many promises, not enough truth.
Exactly, Rasim. People imagine they will walk in with multiple missing teeth and walk out ready for a steak dinner. The reality is more nuanced. Some patients come in with bones so thin that if we tried placing implants immediately, they would fail before the day ends. And no one tells them that part up front.
And that's the scary part. People think the problem is just missing teeth, but the real issue is everything happening underneath. Which is why this one-day miracle sometimes turns into months of stress if you do not know the hidden steps. Dr. Esma, this is where people finally realize the real story. Not everyone starts from the same point. Some viewers might think, well, I only lost a few teeth, how bad can it be? But the moment you explain the foundation issue, everything clicks.
Exactly, Rasim. I had a patient last week who swore she could handle on-day implants because her friend did it. But when we checked her scans, the bone loss was so advanced that placing implants immediately would have been unsafe. She needed preparation first, and when she understood why, she felt relieved, not disappointed.
And that is the point. It matters because the right plan saves people from failed implants, repeated surgeries, and months of regret. When you get that foundation right, the whole one-day idea becomes safer, faster, and actually real. Dr. Esma, people think implants are just screws in bone, but when you look at the numbers, the story changes fast. About half of the patients who ask for one-day implants discover a hidden issue during their first scan. That alone shows how misleading the term can be if you do not know the full picture.
You are right, Rasim. I remember a gentleman who came in absolutely convinced he would finish everything in a single visit. After reviewing his scans, we found old infections under 2 teeth that had never healed. If we had rushed implants into that area, they would have failed almost immediately. Once we treated the infection first, his long-term result was far better.
And that is the kind of detail people never expect. One tiny issue under the surface can flip the entire plan. Dr. Esma, this is the part where people lean in, because the science part sounds complicated but actually explains everything. When people hear implants fused to the bone, they imagine it happening instantly, like snapping Lego pieces together. But, biologically, it is a whole different story.
Exactly, Rasim. Osseointegration is a slow, controlled healing process. The implant needs stability, healthy bone, and zero infection for the cells to attach properly. If any of those conditions are missing, especially stability, the result can be implant mobility. And once an implant moves during healing, even slightly, it risks failing entirely.
Which explains why one-day implants really mean one-day temporary teeth, not instant bone fusion. The science sets the rules, not marketing. Alright, Dr. Esma, this is the moment people wait for. The real step-by-step path to making on-day implants actually work. Because once you understand the order, the whole process becomes way less scary.
Exactly, Rasim. Step 1 is always a full 3D scan, no guessing. Step 2 is planning implant angles and positions based on bone thickness. Step 3 is removing any infected or weak teeth. Step 4 is placing the implants with maximum stability. And Step 5 is attaching temporary teeth the same day, designed only for gentle use.
Which means the one-day smile is real, but only because the foundation steps were done right. Dr. Esma, now we get into the part people love but rarely hear. They must follow rules. Because even if everything goes perfectly on surgery day, the wrong move afterward can undo the whole miracle.
Exactly, Rasim. Patients should avoid hard biting for the first weeks, keep their temporary teeth clean, and follow every hygiene instruction. And here's a big don't. Never test the implants by pushing on them with your tongue or fingers. That tiny movement can stop the bone from bonding properly.
And another, though, show up for checkups. People think once the temporary smile is on, the job is done. But the follow-up visits are the insurance policy for long-term success.